Hello, it is my pleasure to share with you some stories from my nursing career. I'm Linda Lindeke. I'm a pediatric nurse practitioner for many years and also a faculty member, and I direct students in their educational processes in graduate programs, both PhD and Doctor of Nursing practice students. My topic is care coordination with children and families following neonatal illness. The patient population I've worked with for several decades are children in a neonatal intensive care follow-up clinic. Families who come to our clinic have been discharged from the acute care setting and then return periodically, sometimes at very frequent intervals after discharge, and then as years go by at far less frequent intervals. And during the visits to the place where they were originally hospitalized, we have a team assessment, and my role in that process is, of course, the assessment, the interviewing with families, and the coordinating of care of these children. Care coordination is a buzzword of our current era of healthcare reform. You will find that term in the Accountable Care Act and in the policies and practices of payers, of providers, of hospital systems, and of researchers. What is care coordination? Why is it important? And where are families in the midst of this trend, which is to find effectiveness, increased access, and reduce cost of health care? One of the theories is that coordinating the care of children and families across the age spectrum in a life course perspective, if you know that term, will have a great payoff both in terms of improved health status, better relationships, and cost access and good use of resources. The challenge of care coordination is that it doesn't mean anything universally. It is a term that is used by nurses, and when they hear the word care coordination, they say, well, that's what our profession is all about. When you hear the term from the perspective of those who pay the bills in healthcare, it is about reducing cost and overlap and duplication of services. A totally different meaning than what you will hear from the families who will say, it doesn't make sense what I'm being asked to do. It doesn't make sense where I'm being asked to go. Things are disconnected, and I'm not getting what I need for myself, my family, and my child. Part of the reason I think care coordination is less successful in many of the models, demonstration projects, and research studies is this multiple use of the term, but also, and more key to our discussion, is the fact that it is not family-centered in so many of the models of care. So on a weekly basis, it is my goal as a nurse and someone who has a great commitment to this population and to care coordination outcomes to walk into the room with a family who may or may not be receiving the services they and their child needs, and get to the heart of the matter, and do that by exploring the family's meaning of what this illness or this episode of need for care means to this family. Was this a big crisis in this family and child's life, or was this a little blip along the way? I try to find that out very, very early in my interview with the family. Secondly, I try to find out who is important to this child and family, and do that with open-ended questions, which I ask quite quickly and after having reviewed all the electronic and paper records that I can find prior to entering the room. And then I want to know, what are things like today? So care coordination has to be done based on the assessment of today, not an algorithm that says, well, by 1 year out from the NICU, you should be doing this, that, or whatever. No, the care coordination has to be based on the family's assessment of their needs, on the meaning of this child and this occurrence, and on the community in which they prefer to live and do live. I enjoy the daily challenge of working with a family and establishing that relationship through asking very critical questions. And to conclude, I'll share a couple of questions that I very much like to ask and when I get the chance. And one will be, tell me what your child's personality is like. And I can ask this when the baby is laying on a table or in their parents' arms at 6 pounds. I can ask it certainly when they're teenagers, and I get very interesting answers. And that would take another whole conversation to describe, but I find that a very insightful question. A second question I like to ask is, do you worry a lot about child X? And I'll often look at the father, as if there's a father in the room, and often they'll be kind of surprised that I ask them that question. It isn't always the father I address first, it depends on the dynamics. I'm sharing those as examples of relationship-based care coordination that I hope, and I feel from my work with families, has helped do relationship-based care, and that I think is applying the principles of strength-based care and longitudinal thinking, meaning-making, and so many of the concepts that family nurse theorists and practitioners know so well. I've benefited from my contacts with the International Family Nursing Association and the many, many colleagues that are part of this international movement. Thank you very much for this opportunity.